10 essential foods when you have arthritis. 1. Gluten and wheat. These two products, gluten and wheat, can cause inflammatory reactions even in people who have not been diagnosed with an intolerance. Research shows that there is a link between gluten consumption and arthritis, which is often exacerbated by a condition called leaky gut. Leaky gut, a condition in which the intestinal lining becomes more permeable, releases toxins into the bloodstream, triggering immune responses that can manifest as inflammation around the joints. For people with arthritis, which is characterized by chronic inflammation in the joints, this increased immune response can lead to debilitating symptoms such as swelling and stiffness that significantly affect the quality of daily life. According to the Arthritis Foundation, gluten is linked to worsening arthritis symptoms. Many people with arthritis report increased pain and discomfort after eating foods containing gluten. To effectively manage these symptoms, medical professionals often recommend a diet that limits fat, salt, and carbohydrates, which can ease the burden on inflamed joints. For people with persistent arthritis symptoms, especially those aggravated by gluten and wheat consumption, a diet free of these ingredients can provide relief and improve overall well-being. 2. Dairy products. Almost all dairy products contain some type of a slowly digesting protein called casein and can irritate the tissues surrounding the joints. This irritation can progress from joint irritation to full inflammation. 3. Corn oil. Corn oil should be avoided because any food containing unusually high doses of omega-6 fatty acids can cause inflammation. Excess oil, such as canola, grape, or sunflower, can cause inflammation. It is easy to overeat these omega-6 fatty acids because many foods contain this compound. 4. Fried and processed foods. It should be pretty simple why reducing your intake of fried and processed foods can eliminate or reduce inflammation and subsequent joint pain. Research has shown that cutting back on fried and highly processed foods can reduce inflammation and actually help restore the body's natural defenses, regardless of your age or health status. If you tend to eat a lot of fried and processed foods in your diet, cut back. Try to eliminate fried meat and frozen meals from your diet and include vegetables and fruits. You should also remember to drink plenty of water and stay hydrated. 5. Fried, roasted, heated, or pasteurized foods. Toxic byproduct called an advanced glycation end product, or AGE, is found in many foods that are fried, roasted, heated, or pasteurized. It can actually cause inflammation. When these AGE foods are consumed, it triggers an autoimmune response because some of the proteins in the body are attacked. This then causes arthritis symptoms to appear due to increased inflammation. 6. Choose your vegetables. Vegetables like eggplant, peppers, potatoes, and tomatoes can actually make arthritis pain worse. That's because a compound in these vegetables called solanine can cause adverse physiological reactions in people with arthritis. 7. Sugar. Fructose, glucose, and sucrose can stimulate molecules in the body that then stimulate inflammation. You should also avoid drinking carbonated drinks, which are full of sugar and are very high in calories. This can cause weight gain and inflammation. If you're trying to eliminate sugar from your diet, you can choose sugar-free options, add more fruits and vegetables to your diet, and avoid excessive sugar intake. A person's blood sugar levels can rise after eating sugary foods and drinks. Foods that contain refined flour, such as white rice and pasta, can also raise blood sugar by causing the body to produce inflammatory chemicals. These chemicals, known as cytokines, can make arthritis symptoms worse. These types of foods can also cause weight gain if eaten in excess. Heat. Refined carbohydrates. Products made from white flour, such as bread, white potatoes, and most grains, can cause inflammation due to their high glycemic index. In addition, refined carbohydrates can increase the risk of obesity. Obesity is one of the most important risk factors for arthritis. 9. Alcohol and tobacco. Alcohol and tobacco have been linked to a type of arthritis called rheumatoid arthritis. Use of tobacco and alcohol can lead to many different health problems, including inflammation. Smokers have a higher risk of developing rheumatoid arthritis, while alcohol can increase a person's risk of developing gout. So try to cut back on drinking and smoking and make healthier choices that include getting enough rest and exercise. 10. Smoke. Smoking is a major factor in the symptoms associated with rheumatoid arthritis. People who have smoked for more than 20 years have a much higher risk of developing severe rheumatoid arthritis. Smoking can also reduce the effectiveness of some medications used to treat rheumatoid arthritis. Researchers suspect that smoking may also affect the immune system. Fortunately, smoking is an environmental risk factor and is also completely preventable. If you smoke and have arthritis, you should consider quitting. If you need help quitting smoking, talk to your doctor today. Some foods that are regularly consumed to reduce inflammation are high in omega-3 fatty acids, such as fish. Some of them are mackerel, salmon, tuna, and herring. A healthy diet that includes soybeans, tofu, and edamame, as well as some cherries, broccoli, green tea, and any citrus fruit can help reduce inflammation. Whole grains are better than refined grains. Therefore, carbohydrates such as brown rice or oatmeal are recommended. Beans such as kidney, pinto, or red beans are also recommended. Finally, omega-3 foods and oils such as avocado, walnuts, and extra virgin olive oil are fats that can and should be consumed regularly. Arthritis is a complex disease that can take more than 100 different forms. Although arthritis is generally considered an old man's disease, it is not limited to the elderly. Adults or even teenagers can have arthritis. It is usually defined as painful inflammation and joint stiffness. Severe arthritis can affect many daily activities, such as brushing your teeth, driving a motor vehicle, or putting on clothes. About 1 in 4 patients describe the pain as a 7 or more, on a scale of 1 to 10, where 10 is the most unbearable pain. However, some foods can cause more inflammation, while other foods can reduce and greatly reduce inflammation. Even if you don't have arthritis, it's important to know which foods can cause inflammation and which don't or can reduce inflammation. While there is no one food that can objectively reduce inflammation for everyone, there are different foods that may work better or worse for your body. If you have arthritis and are concerned that certain foods may be making your condition worse, talk to your doctor today about lifestyle changes you can make to help your symptoms. You should also talk to your doctor about any changes to your diet that may help relieve your pain. Your doctor will review your history and discuss your options with you. If you notice changes in your symptoms or are considering eliminating certain foods from your diet, talk to your doctor first to make sure you're making the best decision for you and your health. For example, if you eat a lot of dairy products and experience severe pain or inflammation, consider limiting your dairy intake. This is because dairy products can contribute to arthritis pain due to the protein in some foods. The protein found in some dairy products can irritate the tissues surrounding a person's joints. Another example of foods or drinks that can affect your arthritis symptoms is alcohol. Increased alcohol can also increase the chances of developing gout, which can promote inflammation in and around the joints and bones. Nutritious diet rich in vegetables and fruits improves your mental and physical health. You should also incorporate exercise into your daily routine, which can improve your overall health and even alleviate some of the symptoms associated with arthritis. If you smoke or drink and don't exercise regularly, it may be time to start making some lifestyle changes, especially if you're older or already have arthritis. Simple changes, such as small changes in diet and a more active lifestyle, can help relieve symptoms associated with arthritis. If you need help quitting smoking or advice on what foods you should and shouldn't eat if you have arthritis, talk to your doctor today. Which foods would make arthritis symptoms worse? We'd love to hear your experiences and advice in the comments below. Sharing your insights can help others manage their arthritis more effectively by changing their diet. If you found this helpful information, Be sure to hit the like button and subscribe to our channel for more valuable content on treating arthritis and improving joint health. We regularly update our channel with expert advice, recipes, and lifestyle tips to support your journey to better health. Thanks for watching. Your support helps us continue to provide educational content that empowers people to make informed choices about their health. Remember that small changes in diet and lifestyle can help manage arthritis symptoms and improve your overall quality of life. Stay tuned for breaking news and take care.